Dear colleagues, welcome to this week's OncoAlert Roundup covering the top in oncology for the week of May 1st to the 8th, 2025. These are just some of our highlights. For a deeper look and for more trials, subscribe to our newsletter that can be found at www.oncoalert360.com or through the link in this post. That's www.oncoalert360.com. We start off with news from the industry, and the source for this report is the AstraZeneca website. Update on Destiny Breast 11. AstraZeneca reports that the phase 3 Destiny Breast 11 trial sees trastuzumab deruxtecan followed by paclitaxel, trastuzumab, and pertuzumab, or THP, improve pathologic complete response rates compared to the standard neoadjuvant regimen of dose-dense doxorubicin and cyclophosphamide, followed by THP. This is in patients with high-risk, locally advanced HER2-positive early-stage breast cancer. Although event-free survival data are still immature, early trends favor the trastuzumab deruxtecan regimen. We move on to our spotlight publication, The Association Between Risk-Reducing Surgeries and Survival in Young BRCA Carriers with Breast Cancer. In a large international retrospective cohort study of 5,290 women, all diagnosed with breast cancer at age 40 or younger and carrying BRCA1/2 pathogenic variants, risk-reducing mastectomy and risk-reducing salpingo-oophorectomy were both associated with significantly improved overall survival. These results provide robust evidence supporting the survival benefit of risk-reducing surgeries in young BRCA carriers with a prior breast cancer diagnosis, informing personalized counseling and management strategies for this high-risk population. We move on to prostate cancer, and we start off with a publication just fresh out of Estro 25, the Peace v. Storm trial, salvage metastasis-directed therapy versus elective nodal radiotherapy for legal recurrent nodal prostate cancer metastasis. In this phase 2 trial of patients with PET-detected pelvic nodal oligorecurrent prostate cancer, elective nodal radiotherapy combined with androgen deprivation therapy significantly improved 4-year metastasis-free survival compared to metastasis-directed therapy. This is with acceptable toxicity profiles, suggesting elective nodal radiotherapy as a promising standard treatment option pending confirmation in a phase 3 trial. And we move on to the final OS analysis of the Magnitude trial, Niraparib and Abiraterone acetate plus Prednisone in metastatic castration-resistant prostate cancer. This analysis showed that although Niraparib plus Abiraterone acetate and Prednisone, or AAP, did not significantly improve overall survival compared to the placebo plus AAP, it provided meaningful benefits by delaying symptomatic progression in time to chemotherapy, particularly in those with BRCA1/2 alterations, with a consistent and manageable safety profile. And ending up in lung cancer, overall survival in EGFR-mutant advanced non-small cell lung cancer treated with first-line Osimertinib. This large real-world study of advanced EGFR-mutant non-small cell lung cancer patients treated with first-line Osimertinib showed a median overall survival of 28.6 months, with significant worse outcomes in patients with high-risk factors such as poor ECOG status, brain or liver metastasis, or TP53 commutations, and highlighted that 1/3 of patients did not receive second-line therapy despite disease progression. And there you have it, folks, this week's roundup. We look forward to seeing you next week for yet another week of highlights.